Excuse me, are y'all with Planned Parenthood in Texas? Did I hear that correctly?
I'm with Planned Parenthood in Texas. She's
with Whole Woman's Health.
Oh, with Whole Woman's Health.
Yes.
Okay, gotcha. So my name is Robert Sarkis. I'm with a company called Biomax.
Hi.
We do fetal tissue procurement, like for stem cell researchers and things like that. Cool. And we've been in contact with Dr. Nucatola the past couple of months, just talking about which affiliates would be good to partner with and all that. And she actually mentioned both of your organizations simply because the volume in Texas is like at these few clinics that remain are just skyrocketing right now. And volume is important for us because, even if somebody is doing let's say 20 procedures a day, obviously you're probably doing more than 20 procedures a day. But, out of every 20, we can probably only procure, a handful of those simply because of how intact the specimen is and all the different specifications and stuff like that. But so we were looking forward to meeting your medical directors and whoever would be here. So I just wanted to make sure that while I saw you, I could introduce myself. Is your medical director here?
He is here, yes, and I'm going to be seeing him this afternoon, so I can send him over to the...
Yeah, let me go ahead and give you some of our stuff here. This is just a brochure with some of the products. Yours is not. Yeah, please do. I think actually, Amy
Miller,
is the owner or director of all of your clinics. Yeah, I think that we met her at NAF a couple months ago. And I think she said she was familiar with it, but I can't remember.
Well, we do some of it in our Twin Cities clinic, but with ABR. But with
ABR.
Yeah, but we've never done it in Texas because it's Texas.
Oh.
So we don't know really what the specifications would be for us to do that. Do you know?
Yeah, do you know if there are any legal restrictions?
To my knowledge, no. I mean, there's plenty of researchers in Texas that are actively using fetal material, so I would be surprised. This is one of our procurement techs, by the way.
Nice to meet you,
Andrea.
So, there's researchers that are actively using fetal tissue products
we'll be
in
more than
Texas
happy
right
to.
now.
I mean, we do it in our other clinics out of in Baltimore and in Twin Cities.
Oh, you do it in Baltimore as well?
I believe so.
Is that with ABR as well, or with the
with ABR.
Interesting.
And so in Texas, I think we just don't know what that process is. And since we're always under unwanted attention,
we just have to sit down and make sure that we could do it in a functional, safe way for everybody. It's just, both patients and providers seem to really like it because it adds extra. And we just when I and Susan Tenenbaum is my boss, when she and I were sitting down with Deb a couple of months ago talking about this, we were thinking, with just the way that everything is in Texas, with all the oppression and all of the stigma, it might be kind of a welcome,
people feel like
partnership.
They're very appreciative. It's been our experience, at least in Twin Cities, where I've been more involved. They're very appreciative. It feels like they're paying it forward. There's something something positive coming out of the experience.
Exactly. There's a greater good that can come about, even though it's a difficult situation. How long have you guys been working with ABR in those locations?
At least 3 years.
At least 3 years. And is that an exclusive contract by any chance, or is there room for another organization?
I don't know. I mean, I don't think it's anything exclusive, but and I have to double check with Baltimore because I think it's with them, but I'm not sure. But yeah, I mean, it's worth looking into. And for Texas also, we just need to figure out that make sure we don't get any more attention than we don't want to.
Oh no, I mean, it's very discreet. We don't advertise this.
So how would it work? Would it we ship?
We send a technician out to your site. There's a designated procurement day, one of your main procedure days, basically.
Right.
So the procurement tech shows up first thing in the morning, has, the list from me of all the, what all the different research clients are looking for that day.
Okay.
And they just need a little space in the path lab in the back to, receive the specimens, do the dissection, and then just package it up in media and then ship it off straight from there. Exactly. You guys literally don't have to do anything.
I'm super inconspicuous, not to interrupt your flow at all.
They do the consenting and everything for the
like
tissue.
a floater if you guys need it, whatever you need.
Okay. So you would consent each individual client for the...
Absolutely.
Definitely.
That's easier.
And we do return a portion of our researcher fees to the clinics that work with us. So
just so it's worthwhile for everybody.
I think that ABR is doing $50 per specimen right now, was what I last heard. We could do 60. Not that we have to fight over it. I mean, if there's room for us to come in on the next day, like we're happy to do that too.
Yeah, I'm sure there won't be, a problem with volume.
Yeah.
Given, the unfortunate situation the state's in. But
what is your clinic volume like now? How many procedures per week?
Well, I mean, it's changing now because the law went into effect last week, where like the rest of the clinics in the state closed.
Right,
and there's
that's
just
what I heard.
8 that are open.
Right.
So it's hard to predict what it's going to be, but I know that 80,000 abortions happen in the state, and so we divide that by 8.
So I guess I'm just
we're scheduling 25 procedures a day, 3 days, 10 days a month.
Wow.
Is when we do procedures. So we're scheduling 25, and now we're going to be increasing it to 30. I'm the only provider, so there's only so much.
Oh, you are one of the providers. Oh, I didn't realize. I didn't see the
No,
MDIs.
that's okay. I'm the provider at our Austin clinic.
Okay.
But right now we don't know what's going to happen.
How far do you go at the Austin clinic?
21.6.
21.6. And do you dig?
I use dig after 20.
After 20.
Yes.
Okay.
So you guys can't take dig.
Right, yeah, dig nukes the stem cells, so it's just no longer useful. We also, we're typically looking for later gestations, because that just happens to be like the sweet spot with how the cells differentiate and everything.
Okay.
I think that's hard. Well, we go to 22 because of the ban, so we can go further, but definitely dig.
Right, yeah, and they need to be pretty intact as well, like mainly the body cavity. Not too torn up, like we don't want to be playing like find the liver, oh it's in 8 pieces.
Right. Okay, so I mean I do 2 days cervical prep,
Oh, good.
So
it's
not like I'm doing the same day cervical prep, so I can usually get good dilation. So my aim is usually to get the specimens out.
Like an induction type of thing?
Well, no, I do laminaria.
Yeah.
But leaving him in for 24 hours, I can usually get 3 to 4 centimeters of dilation, which usually allows me to extract it more intact. I do that starting at 18 weeks.
Yeah.
The 16 to 18 weeks, I do a same day prep, and so that's just sort of
Do you use ultrasound guidance for that?
Yeah.
So can you convert to breech?
I can if I need to, and if it's I generally don't have to do that I don't usually do it in the 16 to 18 weeks because I don't really need to.
It's just not necessary.
With a further gestation, I will sometimes do that if it's a cephalic presentation, just because it's easier to get. So
because that's what Deb was telling us really makes a difference for tissue collection at PPLA. Is that if you convert to she said if you convert to breech, she says then you get she said you get increasing dilation as the case goes on, and then she says at the very end she's like you can even evacuate the entire calvarium intact if you need to, which you do if there's a request for fetal brain. They're always wanting both hemispheres, and so
I haven't been able to do that yet.
To get the calvarium
intact.
It's like maybe next time.
I know, right? Well, this will give me something to strive for.
Exactly. Exactly.
But I don't routinely convert to breech, but I will if I need to.
And so, but you're not the medical director for Greater Texas.
Director. Our medical director is Daryl Jordan.
Okay.
So, and he's based out of Dallas. He goes up to 17.6.
Okay.
So I'm the only Planned Parenthood of Greater Texas clinic that goes up to.
Oh wow. Okay. Yeah. I mean, yours is the one we would want to work with then, I think. So, for example, like last week, how many 20-week cases did you have?
It varies. So, like last week, I think we only had 2, and I think this week we have 4 on this coming week. We have 4 on the schedule. Plus, I'll be doing ultrasound, so I might get more.
You might get more.
We usually have at least 2. Sometimes we'll do 6 in a week. But again,
varies.
this has just been our second trimester volume has been slowly increasing.
Right, and it'll probably massively increase now because of
Right, exactly. It's just taking them longer to get to us.
How many days a week are you doing surgery?
I do 2 to 3 days. I work every other Saturday, and then Thursday, Friday are days. So, and sometimes we'll add on another procedure day if we're starting to get backed up.
Yeah.
And so, of those two 20-week cases last week, for example, what was the intactness of the specimen like?
It was trunk intact.
Trunk intact.
So usually, what I do is, if it's a breech presentation, I'll remove the extremities first, the lower extremities, and then go for the spine and sort of bring it down that way.
Right. You said if that's a breech presentation, or if that's a...
If it's a breech presentation, yeah. And if it's cephalic, I'll try and get the cal first. But if I'm struggling getting the cal, usually it's a function of how good my dilation is.
Gotcha.
Oftentimes it's hard to get around the cow. Especially the 20-weekers are a lot harder versus the 18-weekers. And so at that point, I'll switch to to breech.
Yeah. Good. Yeah, I was just curious what we might be working with.
I always try and keep the trunk intact, just by function of always trying to aim for the spine to bring it down.
Oh, interesting. So that's what you can grasp is the spine.
Exactly. And so you keep it all in alignment, and it just makes the procedure easier.
Right.
Every once in a while, if the dilation's bad, then I do whatever I can.
Yeah, he's got to change your game
plan.
Yeah.
And that's like a function of the individual patient characteristics.
Right. Yeah. Liver is in huge demand right now.
Is it really?
Yeah,
okay.
Liver. There has been an uptick recently in requests for heart valves.
Okay.
So intact hearts, intact livers. Liver is used in all kinds of like mouse modeling of like different diseases. So where they implant it into like an immunodeficient mouse, and then you can regenerate a human immune system in the mouse model, and then you can do like drug testing and HIV testing and all kinds of stuff.
One of our POC persons is really into organ development, so she'll.
Oh, really?
Yeah, she'll pull out like kidneys and the heart. The heart we frequently see at 9 weeks, and she always looks for it, and so she's
just like for fun.
Just for fun. She just because it's amazing. It's just like it's sort of I have so much respect for development. It's just so incredible how but she's always at 10, 11, 12 weeks she's like trying to find the kidneys and finding all the organs and that gestation layers. So.
Yeah. Have you guys provided any specimens for research ever? Or
no, I don't know if it's ever happened. So I've been with Planned Parenthood just for a little over a year.
Okay.
So in Texas, and so I don't know what they did before.
Because I've been told that Gulf Coast does provide specimens, just out of their own research department. Apparently, it's like it's something that they do. Yeah. But I mean, if they're like we said, we try to do everything for you in that within that space. So if they're kind of sick of it, like we'd be happy to.
Definitely.
Well, I think I'll talk to Daryl.
Yeah, please do.
But also have him
send them by. We'll be here all day and all day tomorrow. So. Definitely. Yeah, it was very good to meet both of you. Thanks for
Thank you.
Good
to meet you. I'm sure we'll be in touch.
All right, definitely. Thank you.
See you, ladies.
Yeah, maybe.